Down at Johnson Space Center, the Human Research Program is responsible for doing all the biomedical research, and sort of the operational technical authority component is the Human Health and Performance Directorate down there. And those two groups work very closely together. They've established boards where information from the research program is communicated regularly to the operational people. And based on that information, that drives the operational people to think about what the health and medical standard should be. And there's also a feedback to the research community, because based on what the health and medical standard is, that tells the research community what sort of countermeasures they should be developing. So, for example, if the standard is that for muscle atrophy and muscle strength, we have a standard that says what percentage of muscle strength we can accept in an astronaut losing in space, that tells the research program they have to develop a countermeasure that will keep those astronauts to meet our standard. At the same time, the research program just develops new information that can inform the standards, so we can refine our standards and make them more accurate. So that data that's coming out of the research program is readily shared from the research component to the operational component. And then the third leg of that stool is then the Office of the Chief Health and Medical Officer, where we develop the policies and we take that information and actually formalize the standards. And we all work very closely together. So for health and medical standards, that the boards down at JSC, they talk about the data, they look at the standards and they say, oh, we have new information, maybe we need a new standard. They propose a new standard. That comes up to the Chief Health and Medical Officer to look at and decide, yeah, that makes sense. We might do an external review of that to make sure that the information makes sense, and someone outside of NASA, a fresh set of eyes, can look at that and say, yeah, based on the data you have, your new standard makes sense. So that's how the data from the research program gets incorporated into actual operational activity.